Call the meeting to order pursuant to Standing Order 1082. Committee is studying the subject matter of Bill C-63, a second act to implement certain provisions of the budget tabled in Parliament on March 22nd, 2017, and other measures. I would thank all the witnesses for coming today. Some have been invited by all sides of the committee. So I would hope you can hold your remarks to about 5 minutes. We've got an hour and a half and 5 panelists, so we can go a little over that. We'll start with Ms. Roussel, Canadian Nurses Association. Welcome.
Thank you, Mr. Chair, and members of the committee for the invitation to be here with you this afternoon. I'm a registered nurse representing the Canadian Nurses Association, CNA, the national professional voice representing more than 139,000 registered nurses and nurse practitioners. Across Canada, there are close to 5,000 nurse practitioners that provide care to over 3 million people in Canada. I'm pleased to be here today to speak about the specific measures related to nurse practitioners, hereinafter NPs, in Bill C-63, Budget Implementation Act 2007, number 2. We are pleased to be here to discuss this important bill ahead of Nurse Practitioner Week, which starts on November 12 and ends on November 18. On May 17th of this year, CNA appeared before this committee to inform members about the important role NP plays in our healthcare system. Our official testimony before the committee on Bill C-44, Budget Implementation Act number 1, noted that NPs conduct physical assessment, order and interpret tests, write admissions and discharge orders and prescribe medications. As an update, I'm pleased to say that NPs enthusiastically joined our October 24 webinar on the update regarding the Form T2201 Federal Disability Tax Credit Certificate, a new authority for NPs. NPs have certified the DTC since March 22, 2017, Budget Day, which was the day the changes took effect. The proposed amendments in Bill C-63 will provide Canada's NPs with the capacity to treat patients to the full extent of their qualifications. As this committee is aware, these qualifications include the ability to complete documentation about their patients' medical conditions. CNA has gone through the proposed amendments in Bill C-63, and we are pleased to let members of this committee know that the amendments complete the remaining clauses where NPs are needed to be added to fully modernize the legislation. As a result of these changes, NPs will be identified in the Income Tax Act and the income tax regulations as eligible to provide certification or reports related to other tax measures wherever certification or reports are currently provided by medical doctors. We are pleased to see that these changes will lead to amendments to the medical expense tax credit, the child care expense deduction, the definition of qualifying student, registered disability savings plan, and the registered pension plan regulations. We therefore encourage members of the committee to accept the proposed changes that will enhance access for patients whose primary care is delivered by an NP in both rural, remote, and urban communities across Canada. As we move forward, CNA anticipates that similar changes will be made to the Canada Pension Plan Disability Benefit. CNA has met with both ministerial and departmental officials at ESDC about changes that will authorize NPs to complete the disability-related medical reports for patients. These changes will not only enhance access to care, but will also lower healthcare costs. Finally, I would like to take this opportunity to encourage members of the committee to support the recommendations that were outlined in CNA's pre-budget submission in 2018. The recommendation outlined in our brief aim to strengthen public health education for healthcare providers, including nurses. Our key recommendations to the federal government are to invest $125 million over the next 5 years on public education in advance of the passage of Bill C-45, which will include a one-time investment of $1.5 million to increase the level of cannabis education for nurses. and also invest $45 million over the next 5 years to scale up PT acute care and community-based antimicrobial stewardship program, including a one-time investment of $1.5 million to increase AMS competence and capacity among nurses for nursing professional knowledge, education, and mobilization program. In closing, I encourage members of this committee to support Bill C-63. We are pleased that the bill builds on the important changes that were found in Bill C-44. Thank you, and I look forward to your questions.
Thank you very much.